Hello, Ben.
Hello, Tony. How are you?
I'm very well, thank you. Now, National Smile Month is an annual event, and I guess it takes on quite a lot of extra significance this year, given the events of the past 12 months.
Yes, National Smile Month. It's been a long journey this year, I think. The last 12 months have put considerable pressure on people's oral health. There's a lot of patients who are increasing the frequency that they snack, reducing the time that they brush. I know the fight that I have with my children during that difficult period was challenging. And we're also seeing a bit of a Zoom boom in people wanting their teeth aligned, their teeth straightened. And so the world is changing in dentistry, I think.
There must be lots of extra pressure on dentists because of all the extra sanitization, all the extra PPE, the reduction in the number of patients that they can see. How are they coping?
Do you know what? I'm really proud of my profession, how we've coped through this journey. We're a phenomenally safe industry. PPE is not new to us. It's because what we use every single day. You very rarely see a dentist without a mask on or a visor on. The challenges with practices that has exploded. We've put a lot more procedures in place, which often the patients don't see, managing patients' expectations and managing the trauma and the prevention. The team have worked phenomenally tirelessly. The financial pressure obviously has been massive, but I think that's been pressurized for us all. Working with your patients to make sure that they understand that preventative role, that we can stop dental decay, is something the dental profession has dramatically stepped up to. So the profession has been under phenomenal pressure, but I think we've really responded really well.
And how do you see things going forward? Will there be this horrible phrase, a new normal?
I think I love to avoid the phrase a new normal. I think we will revert back to where we were once we have this vaccine totally embedded within our society. Because over the years, we have dealt with so many infections, hepatitis B, to name but a few. But my main concern is the preventative journey, making sure patients are focusing how they can stop, how they can work. There's going to be a massive evolution in the digital journey that we do. So for example, utilizing Zoom to speak to patients in the preventative journey, managing patients. And I think if we focus on that, we can actually make such a difference in society by having virtual meetings with patients about their oral health.
There are some patients I think will feel, because it's happened to a degree in general practice, that the if we're not careful, the Zoom call becomes the norm rather than the visit.
Yes, I think that's really important to make sure patients have, especially with my world, which is a between you and me. It can be patients can be worried about coming to the dentist. So I think it's really important to use the digital journey as an extra to improve that familiarity, to prove that relationship with a practice that maybe people didn't have historically. So having the normal journey of the pain, the removal of the helping the patient through that patient journey, but utilizing the digital Zoom meetings as an extra to familiarity when people can actually have a chat in their own home. So they're in a relaxed environment, so they take more preventative journey. And that's what I think we as a profession will evolve and celebrate, that preventative, brushing your teeth twice a day, reducing the amount of sugar you have in your diet, and visiting us when we work as a team to improve your oral health.
And I guess the other thing is that because of the pandemic, there's had to be a bit of a realignment, hasn't there, in how dentists work, revision of practices, etc.
Yes, we've evolved considerably. And I think there's a lot of digital managing, especially with the preventative journey. We are really working with our patients to make sure they understand that dental disease is pretty much preventable. And it's a celebration of that relationship when you get that right, because that behavioral change of patients thinking, I can control my mouth, and then start to think how I can make my teeth look better. We're seeing something called, well, it's coined the phrase a Zoom boom. So people are becoming more and more aware of their smile when they're on meetings. They're looking at things, and they're looking at maybe aligning their teeth, straightening them more of the aesthetical journey. So people are becoming definitely more aware of their smiles. And if we as a profession can embrace that to actually do the preventative journey, this could be a massive positive that comes out of the COVID trauma that we've all been through.
So if now a patient wants to do the journey, how do they go about it?
For me, the really important side is dental practice is safe. We've been open pretty much all the way through this last lockdown. The first lockdown, we phenomenally supported by all our PPE was getting sent elsewhere, so we had to manage that journey. The key thing is for patients is to speak to their practices, understand what the journey they're going through, because the dental practices are prioritized the specific patients. We all understand what prioritization is now, and all our patients really have been phenomenally patient throughout this journey. And so now is the time to start getting back with your practices. Speak to them. What do you want as a patient, and what does the practice need you to have, especially in the preventative world we live in?
And how long do you think it will take before practices can see the volume of patients that they saw pre-pandemic?
I think there's a lot of evidence to show that we are a phenomenally safe world, and soon we can start stepping back the preventative journey. For example, if you can go and sit in a sauna now with people in a gym, then the prevention messages we have in general practice, we will be able to step that back and speed that up pretty imminently. So I can see us over the next 6 months getting back to full journey. We're taking it slowly, we're taking it very carefully, and I think it's really important that you understand as a patient where your practice is with that. The practices are there for you, the phones are still working, they're all open. That massive volume may take a while to get back there. I'm not going to use the term the new normal, because I don't like that term. I think we've evolved, and I think we've embraced new technologies and new techniques to maybe never get back to that level again, but focusing on those patients who need our care the most.
So if people do need to seek dental help, how do they go about it now?
So if you have had a dentist historically, phone them, speak to them, manage that journey. If you didn't, speak to one-on-one, see how you get a dentist. My advice is do not wait till you're having toothache. Get in there really early. Prevention, take the opportunity to get your oral health back under control. You can start today by brushing your teeth twice a day with a fluoride toothpaste. Make sure you do it for 2 minutes. Spend in the bathroom, set a little timer, do it for 2 minutes. Give your dentist a phone call, speak to them, see how we're getting on, and think about your snacking regime. Reduce that frequency of snacking. Long term, you'll be able to start thinking about the aesthetical stuff, aligning your teeth, getting your teeth straight. But I think it's really important to get that first step in control. I always talk to my patients about oral health being that first step in control of coming out to this COVID world. Not a new normal. Let's get back to even better than we were before.
Where do people go to find out more information?
Really important, if you want to go onto the Oral Health Foundation's website, or you can find out about our platinum sponsors, which is Invisalign. They've got their own website as well.
Dr. Ben Atkins, thank you very much indeed for your time today.
Thank you very much for your time as well, Tony.